There's a hot button item Republicans in the legislature would rather not talk about: Medicaid expansion.
But before the weekend, a joint committee listened to public testimony on the matter. What they found were stories of struggle and love. Jake Melder has more from inside the State House.
Medicaid expansion is part of Obamacare, an optional program that would give federal funding to states to care for low-income citizens, specifically those who can't afford health insurance through the state exchange.
It's a huge problem for many mothers in the state, especially single moms who don't have health insurance through their employer.
Health coverage comes from two main sources. The poorest receive coverage under Medicaid. Those with more income qualify for rebates on insurance through Your Health Idaho. But there are some who make too much for Medicaid and too little for rebates. The people in this so-called gap would be helped by Medicaid expansion. Testimony today showed there are people in the state who need this help.
He's found dead 3 days after he had passed in his house, and the coroner said that his life could have been saved had he had access to medical care.
An estimated 78,000 Idahoans fall in the gap. If they're unable to pay for hospital bills, it gets paid by county and state funds, an estimated $51 million annually.
Our state itself could really use that money.
Boise Representative Sue Chu is part of the minority fighting to expand Medicaid in the state.
Finally bring back money that we've been sending out as taxpayers to Washington, D.C. that was well due us.
However, Republican leadership is hung up on the federal program. If adopted, the feds would spend more than $650 million on coverage. But over time, the state would start paying a larger and larger percentage of that, casting doubt on the long-term cost of the program. Still, Representative Chu has hope for a change.
The more of us that stand up, I think the more that leadership might be able to say, well, maybe this year.
Jake Melder, Today 6 on your side.